Hi, welcome to the Caregiver Coffee Break. I'm Breeda Miller. Today I'm thinking about jargon, medical jargon. Oftentimes care providers, caregivers, professional caregivers use terms that they don't even think twice about because it's part of their business, what they speak amongst their colleagues. But when a civilian or a patient hears these terms, it can have a different meaning altogether. So yesterday I had a dental appointment. This was not a normal checkup, teeth cleaning. This was a root canal. My anxiety level was pretty high. And to make matters worse, I was late for the appointment. And I got into the appointment. I apologized to the receptionist. She said, "Oh, don't worry." It took me immediately into the procedure room, got me ready to go. The dentist comes in, and again, I'm apologizing because they've blocked out a long time for this procedure, and I was late, and I was anxious. And he said, "Don't worry, we'll get even. We'll get even." Now, I have to say, my dentist is a really nice guy. He's very skilled. He's a former engineer. When he speaks, it's just in a monotone. I have a hard time reading whether he's joking, whether he's serious. So I didn't know what to say. And honestly, I couldn't say anything because by this time I've got wads of cotton stuffed in my mouth and a rubber wedge and all kinds of stuff. And all I'm thinking about is, this is a guy who's holding a really big syringe and a drill and is ready to go to town on my teeth. And he says, "Don't worry, we'll get even." I didn't know if he was vindictive or what. So procedure goes on, all was well, it was fine, not discomfort, but not any real pain. And after 45 minutes, he turns off everything and says, "We're gonna give you a rest now, and we'll be back in a few minutes." So they take some of the cotton out of my mouth, I can speak, and again, I feel compelled to apologize. And I said, "I'm so sorry that I was late, I just took it to heart." And he looks at me and he says, "Like I said, don't worry, we'll get even." I really should have spoken up. I should have said something, but my head was just like, oh my gosh, what's in store for me next? Anyway, the break happens, my mouth is rested, they've done whatever they need to do. So the dentist and his assistant come back to finish up the job. And after another 45 minutes, they said, "Oh, we're done, beautiful." They were very happy with the finished work. And he said, "Like I said, we got even. It's 2:00. And it hit me. He meant they got even with their schedule. That the way he works his whole day with procedures and appointments and how long it takes and people being late, it evens up, which was what was important to them. So the next time you say something in passing or just say something to someone you're caring for, think about, how does it sound to them? How are you communicating the most effectively? The power of words. That's the Caregiver Coffee Break. I'm Breeda Miller. Have a good day.